I saw your paperwork, but go ahead and explain to me a little bit more about what you're feeling.
It's easier if I stand. So I used
Okay.
to do marching band a lot, carrying a snare drum, and over the years, this is like my preferred way of like relaxing. And I didn't realize that's what caused it until like 5 months ago when the sciatica pain started. I did this one time and it like shot down. I was like, oh.
The left-hand side?
Yeah. So that was probably what did it. I guess I was just like stretching this back part out. But that's really the chief concern.
Okay.
And then the compression from years of just like having weight on me and like probably not managing it as well as I could be.
Do you still do the marching band?
No, I stopped in 2019 was the last time I did it.
Okay, so 3 years ago. And how heavy are what you carry?
They're like 25 pounds, I think. It's not much, like,
It's just
initially.
the posture.
Yeah, it's the posture.
Consistency over time. So that's just it, just shooting pain down the back of the left leg?
Pretty much. Do some.
Okay.
I mean, that's a chief concern.
Let me see if I can't figure out why you're having that. Do you have pain right now?
Not currently. It's normally when I wake up and if I like.
So what, on a scale of 0 to 10 right now, what are you feeling?
Right now, it's probably like a 3, just
Okay,
because
it's
I've
still
been
there, then.
taking care of myself a little bit. But if I were to like push my hips forward, I definitely feel it back there, and especially if I were to like take this and kind of cross it over. Maybe not that. That doesn't. Okay, not right now. But
It's okay, I understand. And then how old are you again?
23.
And when did this start?
5 months ago, mainly. I got it every now and again when I would like run. Sometimes I would land on it, and then like my knee would buckle. But it wasn't a major concern until like February.
All right, I'm gonna lift your leg up. Anything here when I do this?
That's all good. It's fine.
And do the bad leg.
That's when I start to feel a little bit more.
Okay, you feel it where?
It starts here, but I feel it there a little bit too.
Okay, you feel it here, like when I do that?
Mm-hmm.
How about now?
No.
Now?
No. Yes.
I'm gonna reach underneath your back, okay? I'm gonna put my hand right here. I'm gonna feel your vertebrae. There we go.
It's all good.
Any pain here where I'm pushing?
That's where it normally originates.
I'm gonna press my hands right here on your bones, okay?
Okay.
I want you to I'm gonna try to mobilize those SI joints and see if I'm trying to differentiate between low back and SI joint.
Okay.
SI joint would not be as bad of a problem as low back.
I feel it mainly when you push on this side.
And when I do that, you can
Yeah.
feel it
Mm-hmm.
here.
No.
Okay. Do you mind if I check your neck really quickly?
Sure.
Like, it looks like there's some irritation in your low back, some swelling, okay? And the swelling is just making it's that fluid is pushing on the nerve.
Okay.
Sitting all day is not going to help you.
Nope. Unfortunately.
If you're home, if you can like lay down
Mm-hmm.
or stand even, but don't stand on that leg,
Mm-hmm.
you know. Do you want to, I can show you on a model if you want. Yeah, come on and sit up for me again. Sorry. Does it hurt to sit up like that?
There's a little bit of discomfort, but it doesn't hurt necessarily.
Okay. Sounds like you have some kind of a lesion. Okay, so these are discs, right?
Mm-hmm.
Here's your spinal cord is in there. See that yellow?
Mm-hmm.
It represents this cable. That's there, okay, that's running through here. When you go forward, you see how the holes open up?
Yeah.
They get bigger?
Mm-hmm.
So initially you like this position.
Yeah.
But then after 15 years of doing that, the disc creeps out towards the back and starts to hit these nerves back here and cause pain.
Okay.
So when I'm doing all these tests here, I'm trying to see where that disc is and if there's any disc instability, and there is a little bit.
Mm-hmm.
Okay, so if we took an MRI of your low back, we might find a compromise. Probably down in here. Okay? Me pressing on the SI joint, this is what I was pressing on. I was pressing on it from the front here.
Mm-hmm.
Okay? It didn't match SI joint, because if I press here and you're having pain over here on the left-hand side, if I press here, this side should hurt.
Right.
And if I press here, this side should hurt.
If it was an SI joint?
Right.
Okay.
But that's not what happened. What happened was I pressed here, I moved the fluid that way, and now it hit the nerve.
Okay.
Nerve fired. This is probably more likely a disc or some kind of arthritis in the low back here.
Interesting.
Okay. It's not terrible. It might not be a herniation. It could be a bulge. I wouldn't know for sure unless we had an MRI. I don't take MRIs unless you're not getting better and you're getting worse. If you're getting worse, then I say MRI. I skip x-ray. I don't care about x-ray. We go MRI. This is a soft tissue lesion. So if this doesn't get better from today and you're like, you know what, I'm getting worse, we do MRIs. They're about $200 to $300 cash. Or if you want to go through your insurance, you got to go to your medical provider.
Okay.
And you go, like somebody in your network, and then they will refer you to an MRI. You say, I'm having radiating pain, I need an MRI. My chiropractor said I need an MRI. Okay. Then your insurance will pay for it. Those are your options, okay?
Okay.
If you get better, then we'll just deal with it and we'll let it ride, all right?
Okay.
So that's my opinion. My opinion might change over the course of the next 30 minutes, but right now, that's what I'm feeling. I'm going to feel your neck really quickly, okay? Oh, right side feels good. Left side, I don't know. That's what was confusing me. Most people don't have congestion on the left-hand side, but you do. I was like, I better sit them up just to confirm. Most people have it over here. Which side feels more tender, left or right?
I'll say the left one.
Okay, that's a backup. I'm a magician. No. Just know how to feel, okay? So that backs up into the left-hand side, and that's why you might have headaches on the left. I don't know if you do or not. But I still need to get this steering wheel correct, okay? Because if you're driving the car like this, guess what's going to compensate? That. Okay. Okay, yeah, it's pretty locked over here. Oh, it needs it. Here we go. Oh, yeah, that's bad. Not anymore. Very good. Let that drain. We're gonna park in the other end, okay?
All right.
There it is. You did it. You did it. Ooh, nice. Lovely flexibility now.
Wow.
Yeah, it's really good. Just let that rest, okay? I'll come back to it. We're gonna go to the feet. Another side of you here. Are you really placing weight on that foot? I think you are. Good. All right, ankles. We're going to do the ankles, okay? Oh, it's tight. Okay. Is that okay?
Yeah, it's fine.
I mean, does that hurt your low back?
No, that does not.
Okay, this is the good side, so good. I don't have to do that one again. Okay. Does that hurt when I do that? Low back?
It's all good.
See, the neck, adjusting the neck already takes pressure off of the system.
Okay.
That's like 90%.
Yeah, there's a little bit of discomfort when you take it right there.
Like here?
Yeah.
Okay. Here we go. Very good. That's what I'm going to do. All right. Do you mind having your shirt off?
You're all good.
Shirt off on your stomach. Let's do the rest of you. There's your ear hole. There you go.
I should mention that my lower back twitches a lot when you put pressure on it if it hasn't been warmed.
I see what you're... Oh, I see what you mean. Okay, I'm sorry.
It's all good. It just takes a little bit warming up.
Okay. How about up in here?
That's all good.
You're very, very tight up in here from about T7 up high. I'm going to take care of that for you, okay? Let's adjust it. We're going to get all the adjustments out of the way first, I guess. Deep breath in. Perfect. I'm coming. Yeah, there you go. Okay, I'm not going to go any lower than that for now. I was going to say, I'll wait for you guys. And out. Excellent. I'm going to pop this one in. Go the other way. Excellent. Relax.
That's such a small crack.
No, hey,
Just deep in there.
every crack counts. Every single one of them. It's the correction. It's the other side. The guys that came up with these moves are long gone. Okay. It's all right. It's interesting because it's more swollen on the right. It's interesting.
When you push down there, I can definitely feel
Can
a
you-
lot.
Do you feel this versus this?
That more.
More? Is it too much?
No.
I can back off.
You're all good.
Part of this is me testing. The difference between me and a massage therapist is I'm working with the nerves that are encased in the fascia.
Okay.
Okay, so a massage therapist is going to work on the soft tissue, the muscles. They can work on the fascia as well, but their target area is not a nerve.
Okay.
Okay, me, I kind of come in here, all right, like I'll show you on the sacrum, and I'll feel for them.
Yeah.
Hi, that's a nerve.
Jeez.
There's another one right there. And I know where they live, and I don't poke at them like that. But that's how we work as chiropractors. The muscles just get in the way. Fascia gets in the way. The nerves are encased in fascia. And one thing that we can do to help greatly reduce pain is release that fascia for you. Now, is there still a disc lesion? Yeah.
Okay.
Yeah. Okay, I can't fix that. Nobody can. The only thing we can do is take pressure off of it and let it ride for as long as it can, okay?
All right.
There you go. And hopefully it never causes you too much more pain. If it does, then that's what, drugs and surgery are for. This is very low tech here, except for my brain. That's the only high tech in the room with this treatment. My brain. There we go. Good.
I can feel my back fighting back.
It's okay. It's okay. It's going to do that for a little while here. Your nerves are used to being in one place, and I'm saying, hey, can you go somewhere else? Can you move out of the way? Your body's like, no, I've been living here for a very long time, okay? And now you want me to go somewhere else? I don't think so. So what your body does is it walls it off.
Yeah.
And I'm saying, you know what? I'd like you to go in another posture and assume a different position. Sometimes it happens today, sometimes it doesn't. No big deal. This isn't a one and done, okay? It takes time. People get upset about that, but it's just the way it is.
It's not what I'm expecting.
It's just something. If I can get 10-20% relief, I know we're doing good.
I'm looking for knowledge.
Well,
How to make it better.
Okay.
Good time.
I can do that then. Okay, I'm going to tell you, you got to mobilize this mid-back. Stop sitting so much. See this? It's
Yeah.
locking up on you.
Uh-huh.
Why am I not down in here? One, you're flinching, but two, there's no real problem here. It's all up in here. This is all getting worn out down here. Like thin, you're wearing it thin. We got to start mobilizing this upper back. And unfortunately, through sitting, it locks up. It's just the way it goes. All right, here we go. Elbow, all right? Into the mid-back, not the low back. I'm done with the low back. I'm going to bust up this whole rib cage here. There it goes. There it goes. Excellent. Isn't this fun? Right there. This left side is the worst, okay? Yeah, it's pretty bad from about T5, 6, 7, 8, 9, 10. Yeah. Ooh, that's just right. There we go. Okay, I'm going to count backwards from 5. Here we go. Give me 5. That's it. 1. Come on. It's coming out. It's coming out. You're doing it. I'm just gonna ride on the other one. There we go. Okay. Excellent. We've all been there. We've all been here. It's like, I know. I'm trying to decompress. Manually. By sheer will.
Lovely.
Isn't there a little gadget that could do that?
No.
Not really. I mean, yeah, but not like this. Now we're going to go down, because these guys actually lift up when you breathe.
Oh, okay.
So now, I know, we went up here, but now we're going to go down here. These guys lift up. This is like the lid of the spine, as my dad calls it. You got to put the lid on. The lid.
The lid.
Yeah, this is the lid, and it's hard to put the lid on.
Yeah.
This is your base, this is your foundation, and this is the lid. This is the top. And the neck is the little bobblehead that goes every which way. This is the lid. Gotta put the lid back on. That took me like 5 minutes after my dad said that. I was like, what? I'm thinking up here. So, you know, that's the steering wheel. This is the lid. Okay. Ah. And then I got it. Oh, we gotta put the lid on. Oh.
The lid and steering wheel doesn't.
I know. They don't like go together. When you're working on somebody, it makes perfect sense. If you're not working on somebody, or you're not the one that's being worked on,
Yeah. I can definitely see what you're talking about.
this is the lid.
My lid is all messed up.
It's on crooked.
It's on crooked.
It's not
One
coming.
side's lifted up,
Oh.
like Tupperware.
Let's see if I see your title. Something about the lid. My lid's on.
Yeah.
Why does she talk so much?
It helps.
It helps.
Yeah, it does help.
I want to relax. It ain't you on the table. That's it. Perfect. Woo, hoo, hoo, here we go.
Oh, this is gonna be good.
Too bad. Just at the tippy top. Here we go. One. Perfect. You're almost through all the hard stuff, okay? You're almost through it.
Oof.
The mid-back is just full of nerve endings up here. One. Done.
One thing I totally forgot to mention is that my right shoulder.
Dislocate.
Oh, yeah, there you go. That's done.
Yeah, I noticed it right at the end. I'm like, oh! All right, here's the bad side.
Yeah. I'm twitching.
It's okay. Your leg is a little atrophied too.
Remind me what that means?
The muscle tone is not here
No.
like it is over here.
How about that?
Yep. Can you see that? Yeah. It's smaller than the sides. It's a noticeable difference.
Damn. Looks like I've been compensating.
That it could be if you've been trying to put more pressure on this leg, or it could be. Do you feel this
Yes.
equally to this?
Well, maybe that's a little bit more.
This you feel more over here
Dude.
than over here?
Yeah, a little bit.
Yeah. To me, this is a little bit of nerve diminishing here. Okay.
How about that?
Yeah. You see how you feel that
Yeah.
compared to that.
I feel the contact pressure more on the right
Right.
side.
You feel me grabbing this versus here.
Yeah, it's not
Yeah.
as strong.
Right. So we have to be concerned about that. That means that you're pinching the nerve here, and it's like a root to a tree. It's withering. Yeah.
That's good.
Well, look, I'm just telling you what I see. Okay. I don't want you to walk out of here and then I'm like, yeah, you're fine, and then you know something happens to you. Okay. So I need you to. It's not the end of the world.
Mhm.
Okay. It happens to a lot of people. A lot of people that come in here. This happens. Why would I even care to look at it? Okay. Because it happens enough that I see it.
From this angle.
So, Can I advise you not to sit? Please
Okay.
don't. Okay, run me through all the things that you do during the day.
Basically, I sit for 8 hours a day, but I get up a decent amount.
Yeah, I need you to lay down for part of that time, okay?
Okay.
You cannot be sitting that long. I need you to take some pressure off of it.
Alright.
It's kind of compromised here. I gotta teach you some exercises. You gotta do them every day.
Okay.
Every day. You can foam roll before 3, and then I want you to stay stagnant. I can try to wake up the nerve, but it's a process because it's being pinched here. This is the pinch. Everything below this point is compromised. Okay, so if I warm it up here and it's still pinching here, what does it matter?
Yeah.
Oh, you're so young too.
I don't know. That's what I get for.
Don't sit. All I can give you advice is don't do it.
It's hard. So I should get a standing.
You're
desk,
gonna
huh?
lose your leg, basically.
Okay.
If you're
Yes.
not, okay, can I scare you that way?
Sure, yeah. I guess
Okay.
that'll work better.
And not lose it like amputation.
Yeah.
You're gonna have the pain is gonna get worse and worse and worse, and then you could cause permanent injury. I just don't want you to get there. If you stop sitting and do what I tell you, you'll be okay.
Okay.
All right.
Standing desk.
Something you gotta move.
Alright.
You can't squash this thing. Sitting, I showed you, right? The disc creeps out the back and hits it.
Mm-hmm.
Okay, here we go. 3 times, then we're done. 1. You shouldn't be able to feel it.
I do.
That's a good sign.
Yeah,
It means
I
you're
do.
alive. Okay?
Ooh.
People whose legs are totally dead, I
Wow.
do that on them and they don't feel a thing.
Wow.
Okay? So the fact that you still can feel it, that's good.
Yeah.
Here we go. I'm going to open this side up. Come on. There it goes. That's a hard one to break open. There it goes. All right, we're almost there. Good. Okay. Going easy, going easy.
It's weird that my right leg is kicking.
It's okay. All right. Perfect. That's as much as I can do for that today.
Is the other side looser?
Mm-hmm. But the nerves are irritated. This is your strong side. So yeah, you can feel it. You're gonna feel it.
That's good.
I know.
That's what I came here for.
I'm sorry. Let me show you. Come up on your elbow. We're pretty much done with that.
Oh my god.
Yeah.
I'm weak.
That helps you.
Oh,
See how he lifts up and this part doesn't move? He's almost like doing a plank. His stomach is coming off. Lower. Oh, this doesn't want to move. You understand?
Mm-hmm.
You need. I've got a basically a corset on and I can do it. Look.
Oh yeah, I definitely can't do that.
Right.
Huh. Okay.
So guess what's doing all the work?
My
Your low back.
low back. Look at that.
Right.
So a lot of
You
cobra.
can gain it. You can gain it back
Mm-hmm.
very quickly. You're only 24. What was it?
23.
23.
Yeah.
You're not mine. I'm 39, 38. I don't want to age myself. Okay, look.
Wow. That's crazy.
Okay. And I know, like, oh, you're a girl. Yeah, watch the male yogis. Okay. No. You got the body for it.
I'm gonna have to become one.
Now, when you bend over,
Mm-hmm.
I don't want you using your low back.
Okay.
No. I want you here first. And then you can straighten. See how my back
Okay.
stays flat? I might
Yeah.
never straighten my legs. But my
Okay.
back stays flat.
Okay.
If you do this, you're putting too much torque on the low back. That's something that the instructors don't always understand when they're
Mhm.
teaching yoga.
Okay.
They're like, yeah, just lean back as far as you can. Go. But they don't make the point of, okay, let's use your mid back first.
Mm-hmm.
Okay? Your low back should be the very last thing that moves.
Okay.
Your low back has great flexibility. I don't care about the flexibility of your low back.
Mm-hmm.
Your low back's just fine. I want the rib cage moving.
Okay.
That's all we got. It's like we gotta rotate the tires. Okay?
Okay.
Your low back has no tread. We gotta move, we gotta shift up into the mid back.
Okay.
Plenty of tread up there.
Mm-hmm.
Got a long life ahead of you up there. Plenty. It doesn't even move.
Mm-hmm.
It's never been used. Okay, so break those guys out and start. Yeah, when you're doing final spinal, people want to use their low back. I'm like, no.
Oh,
Move
okay.
the rib first. Move the chest first.
More about the chin and shoulder rotation.
Yes.
Okay.
Just oil. It's not my elbow. We're all done with that. Okay.
Yeah. Oh, wow.
That's the scraper. Okay.
That's crazy.
And he might flinch, but that's more of a ticklish response
Yeah.
than a pain. You can see it already coming. Oh, he's so fair. You both are kind of fair.
Mhm.
So we can see right through them.
It'll be a fun picture.
Yeah. Woo! Okay, we're not doing too bad today. But no, you're doing good. Does this hurt?
No.
I just hear you breathing. I'm like, uh-oh.
It's an interesting sensation, that's all.
I'm picking apart fascia. It's been trapped in there for your whole life, you know, and now we're just getting to it. Better late than never. Why did humans need to be scraped? Well, cavemen used to hit themselves with a lot in that. We don't have that anymore. Now we sit at desks. We don't get up and move anymore. Okay, so now you need me to come in here and do this for you.
Oh, well, at least you're telling me to do it, for sure.
Yeah, yoga, low impact. I like it.
I like running a lot, but honestly, I don't
Whoa,
think
not with
that's
the
it
back.
for me.
You know what? You just take what you get.
I'm meant to climb hills.
You think she's like, I think I'm meant to climb hills. We're not meant to sit at a desk all day, okay? That's a relatively new thing that humans are turning to do, okay? It's like, why can't we just stop with the iPhone 11? Can we just stop there? Why do we need new technology? Can't we just be happy with the iPhone 11? Why do we need iPhone 12s? We don't need iPhones. Just stop there.
Just stop.
But as our technology advances,
We're gonna end up.
I get
Wall-E.
lots of, my business changed from, impact injuries back in the oil field with the guys working on the derricks to, well, what do you do all day? I sit. Well, we don't have any impact injury, but we have long, progressively sustained postures
Mhm.
that also cause injury, but over time. It's not a blunt force trauma, right?
Mhm.
But it's this long, sustained injury over time. Oh well. It's life.
That's good.
Once in a while you find, stuff, but it's rare. That's why people are like, how are you so happy? And I'm like, wrong kind of doctor.
Yeah.
I'm not in that business. I'm into making people feel better, if I possibly can. Getting all of them out. Now these are just accessories, okay? These are just for fun, because you need it.
Mhm.
It needs to be done, but this isn't directly impacting, low back.
Mhm.
This is just quality of life. Tuck your chin for me, because I want you to change positions and I want your shoulders to be able to work.
Gotcha.
You're going to be placing more weight into your upper back. He's rounded. He has a kyphotic curve. They need to be teaching kids when they're before 15.
Yeah.
If
Those
we
are
really
all-
want to
Shouldn't
change.
have desks.
Well, how else are you going to, little buggers, you going to teach them on the floor?
I used
Yeah.
to
Montessori schools, that's what they do.
Montessori schools.
Mm-hmm. They let them go wherever.
The back looks better though.
Yeah, he's got a nice curve here now. We're carving it, literally carving it out of him. Woo, the heat coming off of him. Yeah, that upper back. I tried to pull out the ribs over here, just didn't want to. A little bit into here. I don't know. Just the way his body Works. Come on up and you can put your shirt on. Actually, like, look. Right in here. That's what all this came out of right here. Right there. You're just, your scapulas don't move.
Yeah.
Because you're leaning forward. I need you more like this. Yeah.
Ready to see your back?
Yes. Oh my god. Wow.
Yeah, it's like. Now, feel it. It doesn't feel.
Yeah. That's
This was the spot that she was showing when she
Yeah, right there.
had you sit up.
wow.
Right there.
That's
Yeah.
crazy.
Now, that goes away in 7 days.
Okay.
By 2 days, it'll be half gone.
Hmm.
Just getting blood moving. Like this one's a little stuck.
Mhm.
Lean away. Ooh, there it goes.
I feel like I just woke up from a nap.
He's alive. Well, it was a little bit intense there for a
Yeah.
second. Yeah. But you could handle another level of this.
Mm-hmm.
That's the crazy thing. I don't even think I got half. It's okay. You'll know over the next over the course of a couple days
Mhm.
how much more you need.
Okay.
Relax. You got it. Breathe. Does that hurt?
Ooh.
I'm gonna really push you. That's all it goes. Other side. I'm adjusting the SI joints. I'm not doing the low back. Remember, the low back's got no tread. I ain't gonna move that. Sure, it'll pop. I ain't gonna move it. What you do at home, I'm not responsible for. Move down for me. You move down this way. Yep, there you go. Bottom leg is straight. Top, yep. Now this side, but be very careful if it even moves at all. Does that hurt?
I definitely feel pressure right here.
Okay, I'm gonna open it up. Okay, I'm just gonna go like this. Too much?
No, it's fine.
There it goes. All right, yep, done.
Wow.
Come on up. Or lay there, whatever you want to do.
Yeah. Let's just take a second.
Sorry.
Whoa. That was crazy. It like shot down real fast. Feels better though. So you got, what part did you just crack?
It's SI joint.
The SI. So the sacrum to
That's
the...
why I test you out in the
Okay.
very beginning.
Mm-hmm.
Okay, because I wouldn't do it hard if I didn't think you could handle it. Back, bend your knees. Yeah, high. Now you know why I did all that work on your mid-back.
Yeah.
I want the mid-back to work. This is your exercise. This is very painful. He ain't a wimp. He just is very painful. Because he's never moved it like
Yeah.
this.
So he should try to focus mainly on his upper back.
And his pelvis, glutes, piriformis muscles.
Is there anything else he can do to stop the atrophy? Is that what
This
it's
here.
called?
I need him to master this one first. You can master this one, we can move on. No, I want you to go a little lower in your back. Right there. That's as low as you go, right there.
Okay.
That's that rib. Remember the rib I showed you that we scraped out?
Yeah.
That's it. The bottom part of that roller is touching it.
Okay.
But yeah, 1 week you will not look like this.
Okay.
Then not in the low back. Because it feels good for the first 30 seconds. And then you're like, ah! Then you can't move. Been there! Okay.
So rib cage is safe.
Rib cage, safe zone. Okay, now, how are you going to come up with it? You are not going to do a sit-up. And I know you feel pretty stuck right now
Yeah.
and vulnerable.
Yeah. I don't know how to do
Again,
that.
we've all been there.
Oh.
Palms up like this. I'm going to show you the cheat. Roll.
Oh. Jeez.
Now let's see. How, you're not even worried about your low back anymore.
No. Crazy.
You're shifting the workload from the low back up to the mid back. You gotta do it.
Man, that really pushes my chest out.
How
That's
it's
a good
supposed to be.
thing.
Wow, look at that. Okay.
This in 1 week, you won't be like
We
this.
should have taken a picture of his posture before and after because
I think I have it
a big
in the
difference.
video.
I thought I had good posture.
No, you look pretty good right now.
Yeah.
Just go ahead and stand up. One knee up. Push. There you go.
Look different.
Um,
Can you tell?
maybe a
We
little
we
straighter.
look at posture all day long.
Mhm.
Yeah, you're just straighter. Yes, that part right there.
Hmm. Okay.
Yeah.
Yeah.
Gotta remember what this feels like. I'll forget, but I'll do it again.
You got a video.
Yeah.
Yeah, your low back is, you shouldn't feel it anymore.
I feel like it took my pelvis and kind of rotated it too.
No, it actually went the other way.
Really?
Went that way.
Huh.
Yeah, that's how you work. That will put pressure on the low back.
Oh.
Yes, you want to rock it forward.
Okay.
Stick the butt out.
Huh.
Men are like, I don't want to do that. I'm like, well, if you want to save your low back, stick the butt out.
Mm-hmm.
The body gets stiff this way. Have you ever seen Grandpa walk around like this?
Mm-hmm.
No. They're all degenerate forward.
I feel like my shoulder is a little bit more stacked on top.
The
than
lid.
they were before.
The lid.
They're like back.
Yes, it's the
Yeah,
lid.
forward.
You understand it's the lid?
Yeah.
Okay. That was enough of a lesson for today.
All right.